Hi, everyone. Thank you so much for joining us for this series of webinars that will focus on diversity, equity, and inclusion. I'm Dr. Denise Martinez, the Associate Dean of Diversity, Equity, and Inclusion at the Carver College of Medicine and an Associate Professor in Family Medicine. The goal of this series is to learn, reflect, and think about one's own ability to impact equity in your life and also here in your role at UI Healthcare. This webinar is provided for educational and informational purposes only and does not constitute providing medical advice or professional services. We appreciate you taking the time to learn more so that we can make UI Healthcare a more diverse, equitable, and welcoming environment for all.
Hello, welcome. Thank you so much for inviting me to this presentation. My name is Adrian Silva. A lot of people just call me Adrian. I am a University of Iowa interpreter. I work here as a medical interpreter for Spanish and have been doing this for about 9 years now at the institution. So I really appreciate this invite to discuss this topic of working effectively with interpreters, specifically in this new environment of telehealth. So thank you very much.
What is your experience with telehealth?
With telehealth, I have had a few years over the last 9 of working with providers using telehealth, primarily video conferences. We kind of partnered with our child health services area to work with some of our families remotely. And so I've worked a lot with families in pediatrics is the main, my main experience. It's working with providers and child psychologists or behavioral therapists. That's kind of my background in terms of telehealth up to now. Things changed, as of March for us.
What suggestions for providers working with non or limited English speaking patients would you give or provide for them?
Yeah, so I'm glad you asked that, Dr. Del Castillo. I think that is kind of what I wanted to focus on. And when I said that things changed in March, I think we obviously all know what I'm referring to with as we started to work with COVID-19 patients in our hospital. Ever since that happened, our telehealth has expanded. We have been working very diligently with all of our providers that are working directly with COVID patients to do a lot of these telehealth conferences. And so let me talk a little bit about how that has changed, and then I'll talk about some of those suggestions that you mentioned. But one of the things that has been different is, like I said earlier, is I've been working a lot with children and their parents, and now it's working with mostly adults, adult family members of our patients that are hospitalized. It has been different in the sense that a lot of these families that we're video conferencing with, we're not just talking to one person or the parent and the child in the pediatric world. We're dealing with or talking to the sons, the daughters, maybe it's their cousin, maybe it's another loved one, whether it's a spouse or you can fill in the family member, fill in the blank in that sense. But so working with providers and talking to all of these people at the same time, sometimes on different screens, and all of that has been kind of the difference. And we've had to change kind of how we do things on the spot. And I've come to learn many things that are beneficial, not just for the interpreter, but also the provider when working in this type of environment. As you guys can imagine, most of the conversations we're having can be pretty charged, pretty emotional, a lot of medical updates, a lot of questions, a lot of uncertainty and concerns that are brought up. And so it's key to really follow some of the guidelines that maybe a lot of us already know to do with interpreters, but I'd like to touch a little bit on those if we don't. And so right away, if you've ever worked with an interpreter, you know that it's really important to speak directly to the patient, to speak in the first person to the patient, and the interpreter follow that same, first person conversation. It's also important if you're able to try to negotiate at some point with your interpreter how much or you're going to say before you take a pause and allow the interpreter to interpret. Depending on who you're working with, that might be an every sentence type of breakdown, and every couple of sentences type of breakdown, or longer or shorter, depending on the conversation. So I would say that if you have the time to connect with the interpreter first before you call or reach the family, that's something you want to negotiate beforehand. Now, when doing these conversations with the providers that I've worked with, we've learned that it's very important to allow for enough time for a response. A lot of times we get caught in wanting to give the updates or give our information, and we might pause a second or two to see if there's a response. If we don't hear something, then it's easy for the provider to keep adding to that. Many times the family would want to say something, but feel that because the provider is starting to talk again, they don't have that opportunity. So what I've kind of learned to do is, if I hear a patient or a family member start to say something and maybe they stop because the provider began, I might right away ask the provider politely and just say, hey, I think the daughter wanted to say something, or I think somebody just wanted to ask, let me just give her that chance, and then we'll say your piece. And then I interpret that to the patient or family as well, right? It's important for me to, for any interpreter, to let the family know what communication is taking place between provider and interpreter. That's something we would do in person in that setting. If there's a nurse or a doctor talking to each other in front of me, the interpreter, and the patient, it's my job to tell the patient what they're saying and keep them all in the loop in that sense. So that's important to do even more in telehealth, because like I said earlier, there's going to be more people involved. And so it might be that not just one person wants to ask something, but you have multiple questions before the provider can go ahead and continue onto the next part of the conversation. So allowing time for the response is very important. Like I said, remembering that the role of the interpreter is really to help facilitate that communication. And so you might want to keep that in mind, because the worst thing you could do is say something that you don't want to be interpreted or you don't want to be relayed. I know many times I catch kind of providers in that thinking out loud kind of moment where they're saying, well, no, that's not really what I want to say. How do I want to word this? Or what words do I want to say? Those kind of things throw the interpreter off a little bit, in the sense that, again, I have to say all of those things you just said out loud. And so I have to second guess myself and interpret that for the patient or family. Now, they might, respond in a way that's questioning. Oh, well, are you sure you know that that's what you want to do? Or how do you know that that's the next step? It just leads to a little bit more confusion if you're thinking out loud. And then telling the interpreter, oh, don't say that piece, because that's not what I can do. Ethically, I'm supposed to say everything. And so it puts us in a weird, awkward position to have to do that, right? So it's best to refrain from doing that. Also, keep in mind that many of our patients and families are what is named limited English speakers. And so that like the name says, it means they have some control of the language. A lot of our patients and families will tell us, I understand a lot of what is being said, I just have trouble speaking it or pronouncing the words, and so hence why I need interpreting. And so keep that in mind, and that's important, because you might say something you don't want interpreted, but there's other family members listening or watching present that do understand what you're saying. And so it's important to keep that in your mind. Something else I like to also suggest is to try to keep your focus during the encounter. It's easy when we're doing these type of video things to get distracted a lot easier than you would in person. For whatever reason, I know that that happens to everybody I've worked with in videos. And so the reason I say stay focused is because it's really important for you to be present at all times in case there needs to be something that needs repetition. As an interpreter, if there's something that I kind of maybe forgot or lost track of the words that you used, I might ask, I might tell the patient in Spanish, let me ask him, the doctors, to clarify something for me, or I missed this piece. And then I'm going to ask you as a provider, what was it that you said after, you know, we're talking about respiratory issues. So what is it that you said after the lung damage that we just described? What did you say next? Now, I've had cases where the provider got distracted with whatever, and they've responded by saying, "Oh, geez, so what were we talking about, or what was the conversation? What exactly did I say?" And when you say that out loud, I have to repeat that in Spanish to the patient. And so if you can make sure that as you're asking your questions, you remain as focused as you would in any other encounter, that's going to be, again, beneficial to prevent confusion, miscommunication, or worse, you know, letting the interpreter just summarize the rest and avoid saying that very important piece that you said. That again is not something the interpreter would want to do, should not do, because it is definitely against our ethics. We're not supposed to be summarizing anything. That allows the interpreter to decide what they think is important to summarize. It puts all of that responsibility on the interpreter, and so that's something we wouldn't want to be doing. And I say that to whenever I speak to any providers, any students, is the importance of that. You're not going to understand the language as the interpreter is telling your patient or family what you just said. So it's easy to get distracted and maybe continue doing a quick note or do anything clinical. But as soon as there's an interruption, it's important to be present for that. And again, another thing I'll suggest too is just there's a technology component, right? There's issues that can come up with the technology or being able to hear properly. It is important to keep to speak in clear sentences, and it is important to keep your thought process and thought groups kind of nice and tidy, if I could use that word. Just because that's how I like to negotiate with my providers when I'm working with them. Is I like to tell, you know, sometimes they'll ask me, Adrian, should I say one sentence, two sentences, a paragraph? I always tell them, finish your thought process. However long or short that might be, if I need to ask you for a clarification or something, I will. But I don't like to have providers stop and try to guess when we're going to step in and interpret, because that just creates a little bit more of an awkward encounter. I like the encounters to go as seamless as possible. I think as an interpreter, one of our main roles is obviously the communication aspect, but I think the other part of that is we are the bridge to that communication. We need to be able to provide these families and patients, and what I like to call is an authentic experience. I think, and that goes back to anything that's said in front of them has to be repeated. So as a provider, you know, make sure that you're doing that. If I'm going to provide an authentic experience, I need to be able to interpret everything that is communicated. And so it's easy to do that when you have a chance, like I said in the beginning, to talk with the provider or your interpreter a little bit before, to try to figure out how can we make this go as seamless for the provider, for the family, and for the interpreter, but make sure we are giving them all the information we would have given them had they spoke or understood English enough or adequately to have the conversation without an interpreter. Many times, because we're using an interpreter, we limit our scope of inquiry. And we shouldn't have to do that. If your interpreter and you as a provider are working well together, you can ask all of your questions. You can have a very thorough conversation about any topic, as long as you have a good relationship with that interpreter and provider.
What things have changed with telehealth since COVID-19?
Um, as you guys can imagine, more recently with the pandemic and our patients that are COVID-19 positive, um, and like I said, these conversations that we're having are long, are very emotionally charged. And so it's just really important as a provider to keep that in mind. I always, when I work with people that need interpreting, I tell them to not allow the interpreter to take over the encounter, to kind of start, directing things. And that's easy to do when you're the one that understands the language being communicated. In telehealth, you have to allow for a little bit of that. And what I mean that is that as an interpreter, you're almost like the storyteller. I feel like I'm the one that has to, when somebody starts to ask a question and maybe gets interrupted, I need to be able to, at least for that moment, step out of my role and be an advocate or a storyteller and say, Dr. So-and-so, I really feel that somebody wants to ask something, or this seems to be important. Let's give them that space first. Then I can interpret your question or continue the conversation. That just changes really the whole environment and the encounter for that family. So I guess I would say in summary is, if take away a point or two from this short conversation we just had, I would say that you want to make sure that you are speaking clearly and speaking directly to the family members or your patients. I think that is maybe a key takeaway in order to avoid you addressing the interpreter, having side conversations with the interpreter, because like I mentioned earlier, the interpreter will have to say all of those things back to the family anyway. And so it's just important for you to remain focused in the encounter and talk to the family directly, speaking in those clear sentences, remembering that most of our patient population are not necessarily medical students or in the healthcare environment. And so talking to them in terminology that they're going to understand. As you guys are aware, and if not, maybe you heard from earlier in this presentation, the role of the interpreter is to help you with that communication, not necessarily to explain what you're trying to say. That's your role, and I'm here to help you with that. And so stay focused in the encounter, speak directly, use terms that you feel are adequate for the audience. And really it's working around those little awkward nuances that come with telehealth, allowing enough time for a response. And sometimes that may take a few seconds, and it feels awkward because you're on video and nobody's saying anything, but you just want to give the family time to process what they just heard, especially in this environment of COVID-19. Many times it's giving information that is very difficult to hear, information that even when you're giving in person is emotional. And so, not being able to have that connection is definitely a barrier, but a barrier that we can all work on together to break, because we want to provide our patients and families the authentic experience of the hospital or of the provider. At the end, I'm almost, I'm acting, I'm a mime. I am taking on the role that you serve. So, a lot of times I step into the shoes of the doctor, giving these news to families, or I step into the shoes of the nurse, providing some education. Maybe tomorrow I'm a social worker, helping families with resources for their loved ones and children at home. And so if you can keep those things in mind as you work with your interpreting teams in telehealth, I think it's going to give you a better experience. It's going to give the family a great experience and good communication. and it's just going to be an overall better experience for everybody. We won't always be able to change outcomes or a person's health status per se, but if we provide the communication, that is going to give that family as best of an experience as possible. I've worked in telehealth with very sick children and families that are receiving terrible diagnosis or just really difficult instructions. And it's really nice to see, even in the worst of circumstances, they're always grateful to the interpreter for helping them communicate and to the providers for being honest with them and for being direct with them and not talking about them in the room with an interpreter, but talking to them directly. It provides them, safety. We're treating them as they should be treated, like any other human being. And it just opens the door for a more trustworthy environment between patient, provider, family, and provider, and ultimately families, patients, and the hospital. And so I hope you take away a little bit of information, maybe something you knew, maybe something you learned, something you can practice and try and start using in your own clinic, in your own unit, or wherever you provide care to our non-English and limited English speaking patients and families. So again, I thank you guys for your time and for inviting me to this. I am sure we'll be sharing my information. If you have any further questions and would like to reach out to me, I'd love to talk to you. Thank you very much.